You've probably heard this before. The only difference between the USMLE and COMLEX is OMM. That's what people say, but it's not true. When I actually sat down to do the preparation for both exams, I realized that the differences between them ran a lot deeper, and not just OMM, from how the exams were structured, what is tested on them, how they're perceived by residency directors. The content may overlap, but how it's tested, how it's scored, and what it means for your future definitely does not. So today, I'm giving you a full breakdown, USMLE versus COMLEX, Step 1 and Level 1. Similarities, differences, format, cost, scoring, predictive value, whether you should take both exams, one or the other, everything you could think of. So make sure you stick around until then. Hey everyone, welcome back to my channel. I'm currently a third-year medical student who just recently took their COMLEX Level 1 and Step 1 exam, and I wanted to give you a full breakdown of what I learned through that process and all the differences, similarities, everything about them in this video, because I had to spend a lot of time learning about it myself. I want to save you that time. Let's get right into it. Okay, let's rewind a little bit. Where do these exams even come from? Why are there two different exams? The United States Medical Licensing Exam, or USMLE, has been around since 1992. It's created to standardize MD applicants across the US being licensed, replacing older state-level tests. They wanted to make it more standardized to a national level. It's run by NBME, or the National Board of Medical Examiners. And then we have the COMLEX, or the Comprehensive Osteopathic Medical Licensing Exam. It's run by NBOME, the National Board of Osteopathic Medical Examiners. And this became required in the osteopathic or DOA starting in 1995. So both exams were actually created in the 90s to ensure national licensure, but they developed independently with different philosophies, different creators behind them. So, which is why the USMLE purely focuses on biomedical and clinical sciences. The COMLEX has that too, but also incorporates osteopathic principles involving osteopathic manipulative medicine. This is where probably people think the differences end, but really that's just the tip of the iceberg. First, let's talk about the similarities. Exams are computer-based. You're going to be taking them at a testing center. It's probably Prometric for USMLE or Princeton for your COMLEX exam. They're taken by students at the end of their second year typically for medical school, potentially fourth depending on your curriculum. So it has your systems-based organ-specific content like anatomy, physio, pathology, pharm, micro, but it also includes statistics, biochemistry, ethics. Now, both exams are pass-fail for Step 1 and Level 1. We'll talk about that later in more detail. And both require hardcore studying, including Your World, First Aid, Anki Dex, third-party resources like Boards and Beyond, Sketchy, TrueLearn, but those are just the broad strokes. Things start to split after that. I'd probably do everything in a pretty unorthodox manner, so I'll talk about my approach and how I use very few resources, but really use them well to their full capacity in another video, so please be sure to check that out in the future. Now let's dig into the differences between them, starting with the structure and the pacing. The USMLE has 7 blocks of 40 questions. So that is 280 questions. It's an 8-hour day that includes 1 hour break time, which you can divide up however you want. This is probably the main difference between the exam, and it can be really tricky to decide how you should do this. You can highlight the text, strike out the answers, and flag questions using intuitive tools. The UI, or the user interface for the program that you take the exam on, is pretty user-friendly. COMLEX Level 1, on the other hand, has 2 sessions, 4 hours each, so it's an 8-hour exam without including the break time. It's split into a morning section and an afternoon section. Each session, morning and afternoon, has 4 blocks, if you will. Each block has 44 questions, so 8 times 44, or 352 questions that you're taking. That's a lot of questions. The breaks are kind of fixed, so you get 40 minutes between the morning and the afternoon for your lunch, if you will, and you get 2 10-minute breaks, one for the morning session, one for the afternoon, after 2 hours each. So you take 2 blocks, take a 10-minute break, take 2 blocks, that's your morning section done. You get a 40-minute break for lunch, and then you do the same for your afternoon. So 2 more blocks, 10-minute break, 2 more blocks, and then you're done with the exam. It's a long day. You're there for 9 hours, potentially 10, depending on sign-in times, checkout, all that. Let me tell you, it's a grind of an exam. Both are, but COMLEX is especially a long day. Okay, let's talk about the user interface. COMLEX is not as user-friendly as USMLE. You have to be using your keyboard to highlight text. You hit Alt-H on a PC and your fingers are just kind of hovering there the whole day. So if you're not a gamer or anyone with a lot of typing experience, your hand can cramp up after a while if you're not used to doing this. So during a practice test, this is probably a high yield tip, is get used to using your keyboard to highlight for your COMLEX. This actually throws a lot of people off during the test. Not a lot of people know about this, so please make note of this. The navigation can be a little clunky. The user interface, as I mentioned, is not as friendly. The formatting is a little bit more ambiguous. It can be also awkwardly worded. People often say COMLEX has some poorly written questions. They're not as straightforward as USMLE, and I would agree with that. The options may not be as clearly differentiated. Maybe potentially having to assume some aspects of the patient history or assuming what is most likely to be able to reach the correct answer on a COMLEX exam. There may also be a lot more first order questions, meaning more factual details. So if you didn't know a certain buzzword, you might not get the question at all. You know it or you don't, essentially. Okay, the cost. For USMLE, it's about $660, and the COMLEX Level 1 is $695. So you're paying upwards of $1,500 if you're taking both exams just for Level 1. Both are expensive, and that's only going to increase for Level 2 and Level 3. This is an investment, guys, and you want to make sure you're not having to take this more than once if you don't have to. Okay, next we're going to talk about predictive value. Both exams are pass-fail, right? Well, here's maybe what not a lot of people explain. Even though technically Step 1 is pass-fail, a lot of residencies still care about this, especially if you're applying from a DO school, because USMLE has a longer track record and has more data backing its correlation to residency success with how many people take it, which is what we mean by predictive value. USMLE just has more predictive value. Programs might not know your actual score, but they will ask you if you took it. If you did and you passed, you can boost their confidence in your ability to handle USMLE Step 2 CK, which is the next exam that you take after Step 1. And that exam is still scored. Meanwhile, COMLEX, although this has been improved over the years, still does not have the same level of institutional trust and systemic trust, especially in historical MD-dominated specialties and programs like dermatology, neurosurgery, and plastic surgery. While both exams are pass-fail, USMLE opens a lot more doors since it has a lot more predictive value. So should you take both? If you're an osteopathic student, this is the million-dollar question, right? Should I take both the COMLEX and USMLE and pay over $1,600? Well, the answer is complicated. I'll make another video detailing pretty much every aspect of this question, but a simple answer here for this video would be if you're aiming for a high competitive specialty and you're aiming for a residency at an academic institution, if you're at a MD heavy hospital system, then you want to keep your options open and consider taking both. If you're 100% sure you want to go into primary care, if you're going to stay in the state that is DO friendly, then potentially you might not need to take STEP as well. Once again, I'll have another video doing a full breakdown about this into nitty-gritty details, considering other statistics, other aspects of your application, including where you're from, what geographical location you want to be trying to match residency at. There's a lot of other factors. So if you would like to see that video, make sure you're subscribed and hit that notification bell to be notified of that when it does come out. Okay, the pacing, burnout, and mental fatigue associated with each exam. This may be underrated. People might not realize this until the day of, because when you're taking practice exams, a lot of them are half length. So you're not taking the whole thing, maybe more than 50%, but you're not taking the whole exam. So you're not stimulating the entire exam. You're not taking from morning till the end, the 9-10 hour session that you would be expected to take on exam day. It's just not that on practice. So it is really a grind. It really burns you out during the day. Both exams are draining. COMLEX, for example, is exhausting because of how long it is. It's probably a 10-hour day for you, and the questions may not be formatted as well or written as well. So the part can be frustrating, and it is a 350 question plus exam. It's a lot of questions, and you're sitting in 2-hour blocks. It's a lot of time to sit in one moment for. You're able to actually take breaks between the 2-hour blocks, but it is considered a unmandated or unauthorized break, so it can be reported to NBOME. People just don't want to risk that, so people just try to get through that 2 hours, then take their break. That can be a lot, especially in the second half of the exam in the afternoon. The last section is especially draining. I think in my last section of the COMLEX, I submitted the hour section in 26 minutes. I'm like, I just can't be bothered anymore. I just hit submit and then left the room. Meanwhile, Step 1, even though you can take your own breaks, potentially if you're taking 7 breaks, it feels like you're not making much progress at each break. Whereas at COMLEX, you're technically only have 4 parts of the exam, right? So like I'm already halfway done after my second break. Whereas in USMLE, you're only potentially 25% of done with the exam with your second break. So there's a lot of mental aspects to USMLE as well. Not only that, the questions might be second, third order questions, so you're thinking a lot during the time, and the stems are a lot longer too on USMLE. So it's a lot of really close detail and attention that you're having to pay, and that is mentally exhausting. And then OMM questions, they can be annoying, they can be tricky, they can be nitpicky. So that's another thing that can be also exhausting for the COMLEX. It is probably just as important to work on endurance as well as content knowledge and test taking, because that can play a huge difference in your performance on the exam day. Okay, so let's wrap it up. What is the difference between COMLEX Level 1 and USMLE Step 1? It's not just OMM. Hopefully you were able to agree with me after this video. It's how the questions are written, it's how the day flows, it's how programs view your scores, and how you feel walking out of that test center. To recap, they might have similar content, but the USMLE has more structured, longer STEM questions, but they may be more direct. COMLEX has a rigid break structure and has more questions. USMLE has greater predictive value for residency, matching, and USMLE Step 2 CK. And even though both exams are still pass-fail now, they still matter a ton, and you want to be making sure you're passing on your first try for both exams. Hopefully you guys like this side-by-side comparison breakdown for each exam. Let me know what you thought about the video and what you thought about the exams. If you have any questions about either, drop them in the comments below. If you like the video, like the video. If you dislike the video, dislike the video. Stay tuned for more content. Subscribe if you want to be notified for whenever I post. As always, it's been Montu Med, your favorite gunner. Take care, guys.